So I'm Mariska with the Neuro Studio, and I'm here with Dr. Allyson Bloom, who is my doctor for doing ketamine infusions. So can you tell me a little bit about your medical experience and then why ketamine?
Absolutely. So I basically, when I went to medical school, obviously you rotate through several different areas of medicine, and I personally was drawn to emergency medicine, and there's a variety of reasons for that. I think just the pace of it, the excitement of never knowing what's coming through the door, and really the ability to just make a difference in someone's life right at that moment, usually on the worst day of a patient's life. So I ended up going into emergency medicine and doing a residency at George Washington University. And the last 20 years now have been practicing as a board-certified emergency physician at an area level 1 trauma center, which has been very fulfilling. And then obviously a few years ago we had the big pandemic. And I think just like everyone, it was a big wake-up call about just the fragility of everyday life and being on the front lines, and really just seeing the destruction of mental health over that time period was very enlightening. And so at that time, approaching my midlife too, I started thinking, what could I do in the second phase of my life? Still enjoying my career as an emergency medicine physician, but something that could still utilize my skills and serve the community in a meaningful way. And that's when research about ketamine started coming out for mood disorders and chronic pain, and now a lot of off-label uses that we're seeing and research that's being done that's very excited on neurodegenerative disorders. So 2 colleagues and myself, who are also emergency physicians, we got together and started thinking about, could we translate this into some sort of practice just based on the very encouraging research we were seeing. And after about a year of planning and hard work and being willing to take a little bit of a risk, we all dove in, and Capital Ketamine and Wellness was born.
So I was joking that, I've watched a lot of Grey's Anatomy, but after the pit, I feel like I'm a much better doctor than I used to be. So now, when you watch that show and they have somebody in an emergency situation, you hear the doctor say 100 of ketamine or whatever. So how is ketamine used in emergency medicine versus how it's used in this type of therapy?
Absolutely. It's a really important distinction. So when I'm in the emergency department, we're dealing with, typically patients who need stronger anesthesia, not quite general, because I'm not an anesthesiologist. I don't put patients fully to sleep where they don't have any purposeful movement or they're unable to breathe on their own. But we do provide a deeper anesthesia, sometimes people call it twilight sleep, where a patient is still breathing on their own, but are properly anesthetized that we could reset a broken arm, or put a shoulder dislocation back in, or just something that may be very painful for a child. So when we're dosing ketamine in those instances, it's at a much higher dose, and it's dosed per weight. We do it per kilogram. So let's just take an average adult. We'll call that 70 kilograms. That patient, just depending on kind of their response to anesthetics, may get anywhere from 150 to 300 milligrams of ketamine to get them fully sedated for what we need to achieve. Now we need to back up and say, okay, what does the research show for patients that are coming for chronic pain issues or depression, anxiety, PTSD, OCD? Now we're dealing in doses that are called sub-anesthetic doses, or we also call it dissociative doses, that are much smaller. So that dose is about 0.5 milligram per kilogram, and that is what all of our solid research is based off of. So really we're talking about doses now of a starting dose at least anywhere of 30 to maybe even 60 milligrams. And that's given, it's an infusion over 45 minutes. So a little bit of medicine is given to you every minute over 45 minutes. Where again, in the emergency department, you're getting that dose They push it in, push the syringe, it goes into your body, you go to your happy place, we fix the issue, you wake up. The difference here is that medication's being administered over a long period of time.
One thing that I will say as an experiencer of this treatment is that you are slightly aware of your surroundings. Like when you come in and you take my blood pressure,
Yes.
I feel the blood pressure cuff.
Yes.
I don't really give a damn about that, but I feel it. It's like I'm completely sort of aware of it. There's also other ways that people are doing ketamine therapy. So there's like injections, right?
Yes.
And then people are using like lozenges. So there's some sort of company that's doing online therapy with that.
Absolutely.
What are the benefits and drawbacks of each different type?
Yeah, that's a great question and very near and dear to our practice because the number one tenet of our practice is really safety. Because it's anesthesia. So you want to know the certification of the person you're working with. You want to know their experience. So you are absolutely correct. There are different modes of delivery of ketamine. There are lozenges. There is an intramuscular injection we can give. There's the infusion that we do. And then there's also a nasal spray that is FDA approved called Spravato, but still has to be administered by a certified provider within an office setting, and you have to be monitored. Now, the online distribution that we're seeing, those are typically lozenges, sometimes things called troches that are almost like lollipops. And so, it's a lot cheaper, so that's obviously in favor of the patient. It's cheaper to do that online mode of delivery. The issue comes with appropriate monitoring and safety because there are things that can happen. There are many, many instances of patients who have accidentally overdosed or intentionally overdosed. There are patients who don't get on the screen with the online provider and don't follow through with the monitoring, and there are things that can go wrong. So we recognize that there are benefits, again, I would say time, not needing to travel anymore, and cost. But we do think safety is compromised in that area. And there was just a recent patient death of a patient who was using an online provider.
Which brings up Matthew Perry.
Absolutely.
Because I think that when Matthew Perry died and they found ketamine in his system,
Yes.
So my thought, understanding like how I have felt using IV ketamine, was that did he just drown, right? So can you talk about like what happened there, like what your understanding is?
Yeah. So just legally, I'll say I did not participate in any care of Matthew Perry. I'll just state that from the outset. We know what we know from the details of the autopsy and what's been revealed to us. I think the biggest thing was Matthew Perry was not sober. I think we just need to get that out there. This is a patient that falls into a high-risk category, someone with a history of addiction. He was seeing a ketamine provider for IV infusions, and I believe it was 4 or 5 days prior, he had an IV infusion administered to him. The reality is, ketamine has a very short half-life, so it is out of your system, very quickly. So when they went at autopsy and looked at what was in his stomach, he had the levels of general anesthesia when you're fully asleep in his stomach. What does that tell us? It was not the IV ketamine. It was all the other ketamine he was being provided, and we know that person's been identified, who had been basically selling him, ketamine under the table with an assistant who was feeding it to him in a parked car, so we hear, mixed with other medications. I believe he had some opiates and maybe barbiturates. It's a recipe for disaster. Ketamine is an exceptionally safe drug when it's administered by people in the appropriate doses and clinicians who understand how to work with it. But I think really the take-home message from Matthew Perry is the IV infusion he had received had nothing to do with his death when he died. And I think it probably was. He was altered and likely drowned.
Yeah.
Yeah.
So I have not done ketamine recreationally.
Right.
So I don't even actually know is it a pill like that people get? And then because of the experience that I've had at the doses that I've had, I've heard about it as like a date rape drug, which I totally understand.
Mm-hmm.
Like if somebody gives it to you that
Yeah.
you cannot really function, but I don't understand it as a party drug because I feel like I can't even move.
Yeah.
When I have had it. So what is it, the dose that people are getting?
It's the dose. And it is typically pills. And it really is the dose because you really can get to different levels of euphoria, of dissociation with the dose. And you might not remember, we started at a certain dose with you. And as we went, we went up a little bit each time. And you probably felt a little more dissociated, disconnected. Not every patient experiences ketamine the same way. Some of our patients don't have that euphoric sense. Some patients
That's
have
a shame,
Yeah.
honestly.
And they don't. Some patients just feel peaceful. Some patients have a spiritual experience. We have some patients who relive traumatic experiences, but that is the point of their journey, to go back and unpack some things and process them with their therapist that they've really pushed down into the subconscious. So it really is about dosing. And the other thing is, when people are recreationally using ketamine, there's other stuff likely that's in there. It's cut with other things, and you've got the effects of whatever else is in that tablet. Often people don't even know what they're taking.
So ketamine is a dissociative.
Yep.
What's the difference between that and like a hallucinogen, like mushrooms or LSD?
So a lot of our patients, quite frankly, have tried or experimented a little bit. We have a lot of patients who are, seeking the psilocybin experience, which is becoming more mainstream now, I would say.
And legal in DC.
Exactly. So the difference is most of our patients don't have a vision of themselves riding on a unicorn through the clouds. And we really talk about the hallucinogenic experience, where patients may have experienced a bad trip, right? A clown was running after them with a knife and they were running for their life. That's not how ketamine works. When we talk about this dissociative effect, it really is this feeling of an out-of-body, and again, not every patient experiences it, but an out-of-body experience where you almost have a bird's eye view of yourself. You really feel disconnected from your body. You can see your hands and toes, but just like you said, you're like, are those my hands and toes? And can I move them? Or I don't think I can move them right now. But it kind of shifts your perspective at looking kind of a bird's eye view and looking at yourself from outside the physical body. And that's kind of where that idea of dissociation. And it also kind of, with this dissociation, you talk about, I really didn't care that a blood pressure cuff was squeezing, a high level of ambivalence to what's going on, right? So ketamine for putting a shoulder back in, high level of, it's painful, but I don't really care because I'm in my happy place.
Right.
So high level of ambivalence, kind of changing your mindset as well.
So how does ketamine work in terms of first like mental health, but also who figured that out?
Yeah.
How'd they figure that out?
So the earliest research we have, which a lot of it's out of Yale, is patients who went in for surgery with ketamine. So these were sometimes higher doses of ketamine, who were depressed. These are depressed patients who went and had hernia surgery or whatever they were having done, who started remarking that they felt so much better from a mental health standpoint weeks later, or just immediately after, I feel so much better. That someone started kind of putting a link together that there may be something here, that ketamine's actually doing something to the brain because the patients are a lot happier. And that's kind of that started fueling that research. So a lot of research from Yale, and that started spurring a lot of research out of VA hospitals, particularly in veterans with PTSD. So that's really, I would say, that was kind of the jump-off starting point. As far as how, knowing how it works, I think we're getting better at understanding it. I would absolutely be lying if I could tell you, here's how it works, and we know this is how it works. A lot of good hypotheses, and I think a lot of it's probably true, but I think it's so complex and there's so much more. Without being too scientific, The way we think ketamine exerts most of its properties is by binding to a receptor in the brain, and ketamine is able to cross the blood-brain barrier. It binds to a receptor, here's the boring part, called NMDA, and it affects something called a messenger called glutamate. And glutamate has this ability to basically actually decrease inflammation in the brain. We know as we age, we develop inflammation in the cardiovascular system, the GI system, and the thought is the same thing. As we age, our brain becomes inflamed. So it exerts effects not only on the neurotransmitters that make us happier and lessening the neurotransmitters that make us less happier, it actually acts on something to promote neuroplasticity. And that is a little really remodeling the brain, repairing damaged nerve cells, and also just opening up connections in the brain that aren't being used or have stopped being used because of this chronic inflammation we have going on.
So you know a lot of my story, and you know how I found you was sort of two parts.
Yeah.
One was that I had been going to therapy because I had a lot of medical trauma from having MS and then having cancer, and then feeling like therapy wasn't doing anything for me. Like I felt like I talk about my feelings, you examine your childhood, whatever, and I just felt very stuck. But then simultaneously I had been, because my spasticity had been kicked up a lot because of how just emotionally I was feeling, I ended up finding that information about neuroinflammation and reduction in spasticity in like a certain case. So because this is really, targeted to patients with neurological conditions, can you talk about how ketamine therapy can be helpful on the mental health side of dealing with all the shit you're dealing with, but also what specifically it might be doing in the brain that can help with those conditions?
Yeah. So from the mental health side, I think the biggest thing is helping with the neuroplasticity component, certainly kind of really shifting our perspective and how we think about things, how we view the world. Do you have a negative mindset? It absolutely has effects on the different neurotransmitters that are implicated in depression, like serotonin, dopamine, norepinephrine. And then just being able to kind of pull things that we've repressed. And I don't think we have a good, the actual act of a patient dissociating seems to help them recover memories and feelings about traumatic events, because you are so on the money when patients say, I've done so much therapy, I've talked until I can talk, I've hit a wall, I'm not getting better. And let me be clear, we are a huge proponent of you must do the hard work. Ketamine alone is not the answer. Ketamine paired with therapy is very important for that reason. But a lot of patients will come in and say, ketamine finally got me over that hump. It let me finally move forward in therapy. But I don't have a great idea. How exactly does ketamine do that? I'm not sure. But we also know patients who are actively suicidal, they can feel better within hours. They literally start feeling better within hours of a ketamine infusion. You can sometimes prevent a patient from being hospitalized by giving a patient who's suicidal an infusion, which is so encouraging for those patients who have ultimately usually tried everything. From the neuro side, and again, all of this is still, I would say, experimental, new, being researched, not FDA approved, certainly. And I think probably I could speak to, I think inflammation's a big thing, and that's probably why we're starting to look at it with things like Parkinson's and Alzheimer's. Could ketamine have a role in decreasing inflammation in the brain, improving brain fog, improving cognition? As far as MS, what we actually see is ketamine can play a role in repairing myelin, which, if you don't know, with MS, it's that kind of fatty sheath that wraps around little tentacles of cells and allows electrical activity to run further down and pass from cell to cell easily. We see in MS, gradual kind of destruction of that myelin sheath that leads to that spastic gait you were discussing and that you experience. Ketamine can actually repair nerve cells. So it actually wakes up dead brain cells. It can actually regenerate myelin along those sheaths. So very exciting research. It's definitely new. I think, unfortunately, it's probably going to be a few more years before we get anything meaningful.
Not covered by insurance.
Not covered by insurance.
And also not cheap.
Exactly.
But I think, definitely the experience is that I definitely would want a real doctor. Because I remember before I came in, I had to fill out like a questionnaire, and it was like a lot of my medical history. But in that, you asked some very specific MS-related questions. Mm-hmm. Can you talk a little bit about why you would ask certain questions of certain patients and what would maybe make them not the right candidate?
Yeah. So I would say for ketamine, ketamine can have side effects. From the psychiatric side, we don't offer ketamine to patients who have a history of any psychosis, schizophrenia, or mania, because it can set off a psychotic episode. So those patients are usually not a candidate at all, unfortunately, for IV ketamine. The other sort of patient we worry about is someone with really out of control blood pressure, because during the infusion itself, one of the side effects of ketamine is it'll often raise blood pressure, anywhere from 20 to 30 points, the upper and the lower number. So it doesn't mean that if you have high blood pressure, you can't come. It just needs to be controlled, and that's something we're actively monitoring during the infusion. Other things that we, think about are any history of complications with anesthesia prior. There are patients that have experienced irregular heart rhythms or intractable vomiting. And those, again, ketamine ultimately is an anesthetic. So we need to know that heart is healthy. And another big one is sleep apnea, because you do get sedated in the room, and if someone uses CPAP machine at night, your oxygen level can fall. We may need to give a patient a little oxygen to help them through until they're more present. So that's another area that we screen for. And then the last is ketamine, when used chronically, and I would say at very high levels at the abusive level, patients can develop something called ketamine cystitis. There is a metabolite that can be very irritating to the bladder. So you might have read some articles. There are certainly drug addicts who actually have to self-cath themselves because they lose function of their bladder. Either they retain urine and can't spontaneously urinate, or they have incontinence. So that's something, and MS can affect sometimes people's bladder habits. So we always want to screen for that and make sure what is the level of function of the bladder before you begin this treatment.
Thank you.
Yeah.
We are actually going to have a couple more videos, because I think that this is such a fascinating area, and I really hope that it becomes covered by insurance, because for me it really was the thing that made a difference when I just kind of couldn't get out of my way, is the way I would put it. But also my spasticity was so bad, and after a series of infusions it got a lot better.